We will move to other stories in the meantime because Ghana has recorded a significant drop in active COVID-19 cases between February and April 2021. That's from over 8,000 to less than 1,500. Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, is attributing the significant reduction to the vaccination exercise. According to him, the number of Ghanaians taking the safety protocol seriously went up to 52% when the vaccination started. This was key in his update to the press Sunday afternoon.
When you get to the Kotoka International Airport, which is a very major area of preventing importation of cases, we have so far tested about 1,400. We have recorded 1,435 cases since we started on the 1st of September last year. Majority of them are non-Ghanaian citizens. Males outnumber 63% of that. We've done 233,000 tests on arrival since we started, with a cumulative positivity of 0.61%, and so it's not as high as the local community ones. But as you can see in the next slide, since January last year, our numbers that is being required at the airport has significantly reduced, averaging around 90s for every month. Around the Easter, we had a few issues. But that is not to say that we are out of the woods. We still have significant threats, especially with the third waves in Europe, the rising cases in India, Brazil, among others. These are also poses a threat to our cases, so we need to work very hard to prevent them, and that is why the work at the airport remains very, very significant, especially with the advent of new variants, which we may not know how the Ghanaian population will handle that. So the positivity rate at the airport has significantly reduced, but there's a slight rise, and I think that's all because of that. We have received a total of 966,850 vaccines, 600,000 from the COVAX facility, 50,000 from as a donation from the Indian government. We have 165,000 from MTN Africa, and then 149,000 as a second also from MTN Africa, bringing the total about 315,000 from the MTN group. Based on some of the WHO recommendations how to deploy AstraZeneca, the recommendation is that it has to be the dosage of between 8 to 12 weeks interval doses. That is, as far as vaccination is concerned, what we have most important is the minimum time within which a second shot or booster dose can be given. If you do it before that minimum date, you will not get any benefit. But sometimes the longer you wait, it still doesn't matter that you can still have your second shot and get your booster dose build up. The WHO have done a lot of studies and has also shown that number one is that if you give it before 4 weeks or before 2 weeks, there's virtually no benefit. But between 8 and 12 weeks is the best time to give. Even then, you would have lost some percentage of your antibodies. It's still effective enough to protect you. What is the efficacy of one dose? According to the studies that have been done globally and around, it protects you about 76% protection for over about 90 days, which coincide with the 12 weeks we are talking about. But that's not to say second dose is not important. And so, given the vaccine availability, that is why we are now trying to shift it to the 12 weeks. But as vaccines are made available, like I said, the earliest is the 8 weeks, and that you'll be giving your vaccination. There are significant efforts being made, and we have some assurance from COVAX that by May we'll get vaccination, and if we get our vaccine in May, we'll be able to do our second doses and as a service, we are more concerned with having more people with the first dose. Because that's what can also cause the distance. But we've got enough, and there are also bilateral arrangements that are bringing in other COVAX vaccines.
You're live on News Desk. Meanwhile, the country has had to discard thousands of expired vaccines as at last Friday. This is according to the Ghana Health Service. and it is mainly due to poor patronage of the rollout in the northern region. That has also been addressed by Dr. Kumabuaje.
It has been the story that we had thousands of vaccines expiring in some regions. The truth of the matter is that the last 115,000 cases vaccines that were received, the second one we received on the 30th of March. The expiry date was on the 13th of April. So that means that by the time we offloaded and distributed to the region, we started distribution on Good Friday. That is when vaccines were moving into the region to ensure that they are used before they expire. All regions were able to use it except for 480 doses that could not be used in northern region and 100 doses in OT. That is 48 bottles in northern region and 10 bottles in that. If you look at the obviously that's quite low, and so the numbers are not so, but looking at the time frame that we had, I think we should congratulate the API program, the public health, and all the people in the region for the sterling work they did to ensure that the vaccines were given to people. Some of them were going to churches, going to chiefs' palaces to make sure that people who deserve the vaccines receive it. The total uploaded number of vaccines in our database is 783,560. But we have done more than about 850,000 already. As they continue to synchronize the data, the number will go up.
Dr. Franklin Esiedebekwe has joined us. Good morning, Doc. How did this happen? Why were the vaccines not patronized by the people?
Why were
the vaccines not patronized by the people? Why were they not given out?
Thank you very much. So, I think that let me use this opportunity to appreciate the health workers and the Ghanaians. You see, if we want to look at the vaccine rollout in the country, there were, let's say, two main batches. So there was the AstraZeneca type that came from India, that is 700,000. That batch is supposed to expire in June, July. So that was what that was started. That one was mainly used in East Africa, Ashanti, and then a little part of Central Africa. Then we had this allocation of 165,000 from Africa medical supplies through MP and Africa. So that one came, and the idea was that let's use that quantum for health workers across the whole country. Then a few days later, we had this allocation only from the African medical supply. But when it came, the documentation was not very complete. So we had to wait for some time to get it complete. But let me, unfortunately for us, these vaccines that came late was also supposed to expire on the 13th of April. So we had to mobilize our team as much as possible to make sure that we deploy. And let me say that we had to go beyond our original schedule of, let's say, focusing on health workers. So let's say, let's get the whole population on board. So you realize you have to go to churches, you have to go to the mosque. Every person that was supposed to get the vaccine was actually made effort to arrive at. So as was said by DJ, I think at the end of the exercise, we had about 48 vials, about 480 doses that we could not give. But I want to put on record that there's a country that even actually declined to get the vaccine when they had, but if we look at the time allocated to get the vaccine deployed, they couldn't. So they declined to pick up the vaccine. But we said that we have a robust management system program in place to can deploy it. So that's why we're able to deploy that large quantity of vaccines in that short period of time.
Right, but it is still a point, Dr. Esiedebekwe, that we have had to, unfortunately, waste some of the vaccines.
No, we don't. I won't say. You see, I think that what I'm going to put on record is that, as I said, if you have a country that decides that they cannot deploy You see, one of the things that Ghana was the first country that had the COVAX facility was because of the robustness of our EPR system. And that was the reason why we were able to deploy that. So in total, if you look at it in total, we were able to deploy over 97% or over 98% of the vaccines within that short period of time. So you cannot get it wholly 100%, but we were able to do as much as we were supposed to do within that limited time constraint.
But then this isn't just any vaccine, is it? This is a vaccine that is in short supply across the world. And that is why, as at now, when we should have had some 2 million vaccines, we still have some 900,000 doses given out. So for us to lose some, is no one being held responsible, Dr. Bekwai?
No. You see, I think that we need to also look at the narrative in a different. If you look at vaccine delivery, you normally get wastages of about 5%. This one, if you look at it in total sense, our wastage is around 2%. As I said, our team, we need to somehow commend the team for the effort. I mean, if you look at a vaccine that comes and within a short period of time, as much as possible, the population is told. I mean, it needs to be commended. I want to also say that it is not that every Ghanaian is also so free to get the vaccine. We need to also make sure we encourage them. So that's why we want to use this opportunity to also get the Ghanaian to appreciate the fact that these vaccines are safe, and then they are there for you. So we have to also make sure we go to churches. It's also so easy that people are just lined up and they get the vaccine. We also have to mobilize them. So those are all processes that we have to do. As I said, getting it done in that period of time, I think that it is something that the health system did the very best of.
How much has been dedicated to education of the public, Dr. Bekwai? How much money?
Money?
Yeah.
I think I can't say it offhand, but I think that even this, I don't think we are paying you your station, but you're also trying to do it. So
yeah, we do that a lot. There are lots of private campaigns. I just wanted to know how much government is deliberately dedicating to this, even as the Ghana Health Service. I
want to say that if you look at the whole deployment plan, we are putting 51.6 million as our plan. And there are several components of the plan. So, off the top of my head, I can't say how much of it is for communication. But there are key players involved in the communication. We have the Ghana Health Service, we have NCC, we have the Information Service Department, we have the civil society organization. So there are several people who are all trying to do. But let me also say that before we started vaccination, we had a vaccine hesitancy of more than 6%. Now the last count, it has come to around 10%. So it tells you that clearly there's some Ghanaians who are still hesitant. And that's why we think that we should use the opportunity to get them all involved.
Right. Dr. Bekwai, thank you very much for joining us this morning.